Okay, so without any further delay, so I'll be talking to you about a normal immune system. It is important to understand what Prof. Chung is going to talk about later. So it is important that you understand how your normal immune system works. Many of you might have had some information about this or read about it somewhere. So I'll just reiterate that if I will. And then how does immune system play a role in myeloma, and how are we trying to harness it? And I have a very good, interesting video at the end of it. So bear with me as I take you through this picture. Now, our immune system is very complex, hugely complicated, and that is why it probably has taken us better part of one whole century to try and make some sense of it. So the cells on the left side of this is what we call as innate immune system. Innate immune system, you can use another name. If I can use another name, it is just something that you're born with, something that is, probably a little bit crude, not that specific, but you have it within you. Adaptive immune system, on the other hand, is something that you acquire. By example, by being exposed to viruses, germs, whatever foreign things that come into you, the arm of immune system that deals with it is the adaptive immune system. By and large, the immune system is being controlled by a lot of, or being orchestrated by a lot of white cells, and there are white cells come in many different shapes and sizes. You might have heard about neutrophils that we talk about often at your appointments in clinic. You're neutropenic, which means that you're low in neutrophil counts and so on. But there are more important cells as well in your immune system that comes on the right side of this adaptive immune system. Now, neutrophils, macrophages that form part of the innate immune system is like, I would usually tell my patients, they are like police. They don't have very sophisticated weapons, but all they do is just they find problem, they go and attack and try and solve and diffuse it. That is all they do most of the time. But this is how wars were fought back in the 1800s, right? It's not enough anymore. We have more sophisticated germs, more sophisticated infections and cancers, and hence we need to get our immune system up to speed as well, and that is where the adaptive immune system comes in. That is a bit like intelligence. So we need to gather information, we need to be targeted, we can't just go blindly and kill everything and anything that comes in our path. So we need to have missiles, we need to have satellites, we need to have spies even. So that's how the adaptive immune system works. Two main cells that we come across in the adaptive immune system is B cells and T cells. There are many, many more. I'll primarily be talking or paying attention to these things. They have many weapons. One of them is the antibodies, which are very specific targeted proteins that are being produced by plasma cells, which, as you all know, is the cancerous cell in myeloma patients. Then we have T cells. Now, much of information about T cells was not available till about in the last 30, 40 years. So we thought that maybe T cells have a function, but we didn't know what exactly they did, and especially how they worked. Not much was known. Now, in terms of the anatomy, how things are organized in the immune system is via a network of what we call as lymphatics, which is just basically very tiny kind of blood vessels, if you will, and they help to transport these immune cells from one part of your body to another. Of course, we've got a lot of area in our body that needs to be always monitored. We have about more than 1 meter square of skin where germs and foreign things can enter. We have much longer meter square of bowel, for example, that needs to be monitored, and we always are exposed to these foreign things, and we never know when one of these germs are going to enter into our body and cause problems. So our immune system has to be all-pervasive, and it has to be everywhere, really, and that is how exactly it is organized. So you have lymph nodes interconnected by lymphatics, you have spleen, you have liver, you have bowel, everywhere the immune system is there, is present. It's kind of omnipresent. Now, this is the story part, so that's a little bit of science that I'm going to talk about. So story is mostly about immunotherapy. Now, this is a book that I read as a medical student back in the day, seems like a long time ago now. The title of the book, I don't know if you can see at the back row, it's called Commotion in the Blood. Life, Death, and the Immune System. The author of this book is called Stephen Hall. So the story is about how the immunotherapy, as we call it now, evolved. So back in the day, in the 1800s, in 1890 to be specific, there was this young, beautiful girl who lived in New Jersey called Bessie Dashiell. Now, she was friends with one of the most wealthiest American families, the Rockefeller family. Suddenly one day, Bessie gets severe wrist pain. And lo and behold, it turned out to be cancer. To be specific, it was a type of soft tissue cancer called sarcoma. Not much was known about it, obviously. It was over nearly 150 years ago. And these were the days when even a lot of information on how to diagnose cancer was not available. So the treatments were rather crude. What did they used to do? Well, they usually used to go to see surgeons who chopped off the part that had the cancer. Unfortunately, that was done for her, and the surgeon took out the whole arm because obviously he believed that is the only way to get rid of the cancer, and that was the day of treatment for sarcomas in those days. Unfortunately, what they didn't know, they didn't have scans, they didn't have anything at the time, and hence they didn't know that the cancer had already spread far and wide, and Bessie died within a very short time after the operation. Now, because they were very close friends with the Rockefeller family, John Rockefeller was really affected by Bessie's death, as is often a problem when we lose a very young or an adolescent patient to cancer. And it really touched her treating surgeon, who was William Coley. Now we call him as a father of immunotherapy, but it really started off with this patient. So William Coley thought, how really Bessie's death affected him deeply. So he went back and thought, how can we change the approach to cancer? We can't just keep chopping off parts of bodies which have cancer. That doesn't make any sense. So he went back to the hospital records. And the hospital that he was working at is called Memorial Hospital, which we now know is the Memorial Sloan Kettering in New York. And he identified one particular patient, Mr. Stein. And what struck him was, despite the disease seems to be exactly the same as Bessie's, Mr. Stein survived. And when he compared the cases, what he found was different with Mr. Stein was when he had the time of surgery, he had a severe infection. So they thought, maybe there is something going on here. Why if we create infection artificially to patients with cancer by introducing something into them, will it work? Was the question that he wanted to answer. Now, much of the subsequent things that he did will not even get through the first step of our scientific rigor these days. They were not ethical, and it wouldn't happen today. But that is how it started. So what he tried to do was introduce infections to patients with sarcomas, telling them that this is what is going to happen. One particular case that struck, and which he reported later in the literature, was a case of Mr. Zola. Now, Mr. Zola had a very similar sarcoma like Bessie in his throat, of all places, which was nearly stopping him from breathing. And Dr. Coley introduced the same kind of infection that he used for other patients with him. Now, many times this kind of treatment worked, but many times it didn't. So he didn't really know or have an answer as to why it works for some patients and why it didn't work for other patients. But in his case, he didn't give up, and thankfully so. He went for a stronger bacteria, and eventually he found one bacteria that elicited an immune system response in Mr. Zola, such that the sarcoma completely vanished. And he lived subsequently for many years to come. So that he considered was an important discovery. However, it has to live through the establishment. The medical establishment in those days was epitomized by none other than Dr. Ewing. Now, Dr. Ewing has a different type of bone cancer named after him. He was a fantastic researcher in himself. And he thought, what crude thing is this? How do you even fly a treatment like this, artificially introducing infections into patients? It just doesn't sound right. So there was much of Dr. Coley's life was very, very tough. He couldn't get this through what he thought was genuine life-saving treatment for patients, but it didn't fly. Now, fast forward, so that was back in 1920s. Now, if we fast forward to 2010, which I'll come to why the year 2010 is important, but much of this 70 to 80 years has been invested world around by doing basic biomedical research to try and understand immune system. What are the arms of immune system? What are T cells? T cells, the T stands for thymus, which is a gland that is right there behind your breastbone, which kind of educates these type of white cells to identify what is yours, what is self, and what is outside, what is foreign. Similarly, B cells, the B stands for something else, but we can say they are bone marrow, educated cells. So much of this understanding has all gone and been learned in the last 50, 60 years. At that time in 1920s and 30s, when this was all going on, slowly the cancer treatments evolved. They, involved surgery, which was fine-tuned such that, it wasn't as crude as it used to be anymore. Radiation therapy came into being, and radiation therapy was one of the things that Dr. Ewing was doing, and he clearly showed why his treatment was going to be superior and more or less crude than what Dr. Coley was trying to do. And obviously, chemotherapy came around after the World War II, and that really took up and improved survivals, although it was quite toxic in itself in those days, the chemotherapies that they were using. But however, people's interest grew in all these kind of fields rather than immunotherapy, which was kind of lost as a treatment modality. However, simultaneously, research is being done to identify and learn more about this. Now, T cells in particular, in the last several decades, have come to be known as some of the most robust killing machines, if you will, for tackling cancer. But still, people did not know how they identify cancer cells versus non-cancerous cells, because you can't, if you destroy everything, it doesn't serve the purpose. It's a bit like going back to taking the whole arm off for a surgery for cancer. But advancements were slowly made, and mechanisms were found as to how they identify the cancer cells and how they can tell apart cancer from non-cancer cells. And more importantly, how do we harness this power of the T cells to be able to control the cancer cells? Now, if we go back again 30, 40 years, we may not realize this, we may not have realized this when the first treatments evolved, but stem cell transplant is one of the most effective forms of immunotherapy, especially allogeneic stem cell transplant, where you receive a stem cell from a donor, maybe your own brothers and sisters, or sometimes from an unrelated donor. Initially they thought, it was the chemotherapy that worked for these patients, and hence the disease got cured. But then subsequently it was very quickly found out that it is actually the T cells that go from the donor to the patient that actually goes and attacks the tumor cells, and found that was what was actually working. Now, there are several chemicals that these cells release constantly. We didn't know much about their functions and stuff initially, but then IL-2, which is one of the compounds that these T cells produce, just by giving that drug as a drug, when they started synthesizing it, nearly, it might be very low percentages, but 15% of melanoma patients got cured. So that was, a dawn, if you like, for identifying chemicals which can then harness the power of these T cells to be able to work against cancer. Then came the monoclonal antibodies. Many of you might be on this antibody called daratumumab, which we now know is a very effective treatment for myeloma. And similarly, the very first antibody that was actually produced for tackling cancer was rituximab, where Stanford, which is one of the institutes in US, actually, which is where Dr. Darrell went for a few years, was one of the areas where it really revolutionized the treatment for lymphomas. And we are glad that we have a similar rituximab in daratumumab for myeloma at the moment. Similarly, adoptive immunotherapy is where you harness the power of the T cells that works against the myeloma, or for that matter, any cancer, and transferring them from one patient to another, or sometimes from the same patient, but then educating these T cells in the laboratory to adjust them such that they can realize or recognize the cancer cells specifically, and then putting them back into the patients. That is what has changed. Now, 2010 was really a turning point for immunotherapy. Why? Nothing great discovery-wise happened, but that was the first year when we started having results of our clinical trials in immunotherapy for cancers in general. So true enough, the big and mighty, as it were, in the field of medicine, the famous journals started publicizing immunotherapy as a dawn, and we knew at that point that it was a start of a new day for cancer treatments and subsequently in myeloma as well. And even some of the knowledge trickled through to some of the common read weekly magazines, including the Time magazine. This was back about 3 years ago now. I'll see if this video plays. So now, there is a website, a charity-based website in the UK where I used to work called Myeloma UK. You can Google YouTube Myeloma UK. You have plenty of fantastic videos, and I'll just try and play this video for you. It probably makes more sense.
Our immune system is made up of a network of cells and tissues that work together to protect us from germs and foreign particles. It recognizes our own cells, but tries to get rid of anything it doesn't recognize. Each of our cells carries a set of identity tags called antigens that are unique to us. Their role is to stop the immune system from attacking our own body. Anything or anyone else carries a different set of antigens, which the immune system removes before it can cause harm. Different types of white blood cells help make up the immune system. They work together to seek out and destroy anything that is foreign. Neutrophils and macrophages respond very quickly to the first signs of bacteria and viruses by detecting the chemical signals they produce. They remove them by engulfing and breaking them down in a process known as phagocytosis. Other white blood cells, called plasma cells, recognize foreign antigens and react by producing specialized proteins called antibodies. These antibodies lock onto the foreign antigen, flagging it up for destruction by other immune cells. Plasma cells also play an important role in building our immunological memory. This means they remember the same foreign antigen the next time it invades the body. They respond by producing large amounts of the same antibody quickly. Once the invading organism has been removed, chemical signals are released to dampen down the immune response. The immune system also tracks for changes in our body and removes any cells that are abnormal. Cancer cells are abnormal and may carry antigens that would normally be recognized as foreign. However, they also have other properties which stops them from being recognized and destroyed. As our understanding of the immune system has improved, new treatments are being developed which use the immune system to recognize and destroy the myeloma cells. This is known as immunotherapy. Some make use of man-made antibodies called monoclonal antibodies, which recognize antigens unique to myeloma cells. Once flagged, other immune cells can quickly destroy them. Other monoclonal antibodies are made with toxins attached to them. When they lock onto the antigen, the toxin is released, killing the myeloma cell without needing to recruit other immune cells. Cancer vaccines are also being tested. This involves an injection of a small amount of man-made myeloma antigen, which allows the plasma cells to produce antibodies that specifically recognize and destroy the myeloma cells. Other treatments being developed include some which block the signals that normally dampen the immune response, as well as T-cell therapy and virotherapy, both of which are designed to recognize and destroy myeloma cells more effectively. Overall, immunotherapy shows great promise as a treatment for myeloma, offering long-term responses with few side effects.
Okay, you can watch these videos again. Then now there are lots of videos on Myeloma UK website, including if you want to specifically think about a drug that you're on, you want to know more about it, there's all the information there. So please feel free to go and look up. Now, I don't have many more slides to go, which is, I hope, a good news for you. So if you can then classify cancers, there are cancers which stimulate or able to stimulate our immune system very, very well. But there are also other cancers which probably are not going to be that well in their ability to stimulate our immune system. Now, myeloma is kind of in between. It's neither too strong or too weak. It does stimulate the immune system to a degree. So if we think about them, treatments for myeloma, quite a few treatment options have now emerged as immunotherapies. Many of you might be on immunomodulatory drugs that we call, ending with the name IMiDs, called lenalidomide, thalidomide, pomalidomide. So these are all immune stimulating drugs as well. They come under this category. They might be called chemotherapy, but they actually function through their immune system. Monoclonal antibodies we talked about. Now, some of the most exciting things that we are coming up with is something called BiTEs. I don't know who named them. They must have been hungry when they put the name to it. But essentially what BiTEs are the antibodies which help to bring one of those antigens that you saw on the video from that are located on top of T cells and bring them close to the myeloma cells. So if the T cells are wandering around in your body without being able to recognize, this is one way to bring them together. So by bringing the myeloma cells close to a T cell, you're making them kind of eat up or kill the myeloma cells. So that's exciting therapy. And I've just heard about a couple of days ago that Singapore is going to be one of the only, if not one or two countries in Asia that we are going to have access to the BiTE therapy in the very near future, which is always exciting. Now, what Prof. Chung's talk will be is on CAR-T treatment, and I don't want to steal his thunder and let him talk about it more. Thank you for your attention.